Welcome back to the deep dive. If you've ever tried to really manage your own health, you know the feeling. You've got this stack of specialist reports, notes from some wellness app, a lab result PDF you can't even read. It's just chaos.
It's absolute chaos.
And today we're looking at the new dedicated health experience in ChatGPT because it's designed to fix that exact problem.
And that chaos is so real for so many people. I mean, the sources show the demand is already immense. We're talking over 230 million people globally asking health questions on the general ChatGPT every single week.
Wow. Every week.
So this isn't creating a new market. It's just meeting a need that's already there, a huge need.
Okay, so that's our mission today. We're going to dive right in, quickly unpack the features, the privacy stuff, which is critical, and the clinical foundation so you feel ready to use it.
Let's do it.
So let's start with that core function. It's all about solving that scattered information problem, right?
Exactly. The big innovation here is securely bringing all of your health data together, from patient portals, from apps, all in one place with the AI's intelligence.
So for the first time, you can actually see the full picture, not just these little snapshots.
It's the longitudinal picture. That's the key.
So what can you specifically connect right now? What kind of information are we talking about?
Well, for users in the US, a major one is securely connecting your actual medical records. They do that through their partner BeWell.
Okay, so it's like a secure aggregator.
Right. And beyond the clinical records, you can sync your wellness apps, things like, Apple Health, if you're on iOS, of course, and other tools like Function and MyFitnessPal.
This sounds like it goes way beyond just getting a simple summary. So what can a user actually do with all that data combined? Give us a concrete example.
A fantastic use case is analyzing insurance options. It's so complex.
Oh, it's a nightmare.
So by integrating your actual healthcare patterns, how often you see a specialist, what preventative care you use, the AI can basically model your health cash flow against different plans.
So it makes the decision real, not just theoretical.
Exactly. It lets you weigh options based on your personal history. It can also translate those dense test results or help you prep questions for your doctor.
Okay, but you said connecting medical records. We have to address the elephant in the room here. Security. That just sounds like a huge risk to a lot of people.
And it would be if it wasn't handled properly. That's probably the most critical point to understand. The sources really emphasize these layered protections.
So what are they?
ChatGPT Health operates as a completely separate space. It has its own purpose-built encryption and isolation just for health data. It's not a feature, it's a whole compartmentalized environment.
But wait, if millions are already using the general tool, why should they trust this is any different? Is this sensitive data being used to train the models in the background?
And that's the crucial takeaway for you. The answer is an emphatic no. It's explicit. Any conversations, any data within the health space is not used to train the foundation models.
So it stays put.
It stays put. Any health memories, the context it learns about you, that all remains strictly inside that dedicated, separate space.
That's reassuring. And it also sounds like this wasn't developed in a vacuum. I mean, this was built with physicians, right?
Oh, absolutely. They worked for over 2 years with more than 260 physicians across 60 countries. They logged over 600,000 instances of feedback.
600,000.
It's an incredible volume of input. It shaped everything from the knowledge base to the safety guardrails, making sure the system knows when to tell a user, hey, you need to talk to a real clinician about this.
And that rigorous physician-led approach, that leads right into how they actually validate its accuracy. Tell us about HealthBench.
HealthBench is their formal evaluation framework. It uses these physician-written rubrics to score the AI's responses against real clinical standards.
So it's being checked against what a doctor would say.
Precisely. The focus is always on safety, clarity, and most importantly, appropriate escalation of care. It's designed to never encourage self-diagnosis or, delay someone from seeking real treatment.
So when you put all that together, what does this actually mean for you, the user? The core message seems clear. This is designed to support, not replace, medical care.
That's the mandate.
The value is really about feeling more confident and prepared when you're navigating your health, and not just when you're sick, but for tracking those wellness patterns over time.
Exactly. And that brings us to a final sort of provocative thought for you to consider.
Okay.
Given this level of personalized data integration and this clinical feedback loop, what new, more complex metrics will you start to expect your providers to discuss with you? Beyond the standard blood pressure and cholesterol check at your annual physical, what comes next?